6 Secret Behaviors of People with Anxiety, Understanding and Supporting Those Who Struggle. Anxiety is a mental health disorder that affects millions of people around the world. It can cause intense feelings of fear, worry, and panic that can make it difficult to function in everyday life. While many people with anxiety seek treatment and support, there are also those who suffer in silence. These individuals may engage in certain behaviors or habits that help them cope with their anxiety, but they keep these habits hidden from others. In this article, we will explore 6 things that people with anxiety secretly do alone. 1. Overthinking. One of the most common things that people with anxiety do alone is overthink. They may replay conversations in their head, worry about upcoming events, or obsess over small details. Overthinking can be exhausting and can lead to feelings of stress and anxiety. However, for people with anxiety, it can feel like a necessary coping mechanism. They may feel like they need to constantly analyze and prepare for every possible scenario to feel safe and in control. 2. Avoiding social situations. Another behavior that people with anxiety may engage in secretly is avoiding social situations. Social anxiety is a common form of anxiety that can make it difficult to interact with others. People with social anxiety may feel self-conscious or worry about being judged or rejected. To cope with these feelings, they may avoid social situations altogether. They may cancel plans or come up with excuses for why they can't attend social events. While this behavior may help them feel more comfortable in the short term, it can also lead to feelings of isolation and loneliness. 3. Checking and rechecking. People with anxiety may also engage in checking and rechecking behaviors. They may check and double-check locks, appliances, or other items to make sure everything is in order. While this behavior can provide a temporary sense of relief, it can also become a compulsion. People with anxiety may feel like they need to check and recheck everything multiple times to feel safe and secure. This can interfere with their daily lives and lead to feelings of frustration and anxiety. 4. Seeking reassurance. Another thing that people with anxiety may do alone is seek reassurance. They may ask others for confirmation or validation that they are doing the right thing or that everything is okay. While seeking reassurance can provide temporary relief, it can also be a sign of an underlying anxiety disorder. People with anxiety may rely on others to alleviate their fears and worries, which can lead to dependence and feelings of insecurity. 5. Self-medicating. People with anxiety may also engage in self-medicating behaviors. They may turn to drugs, alcohol, or other substances to help them cope with their anxiety. While these substances may provide temporary relief, they can also be harmful and lead to addiction or other health problems. Self-medicating can also interfere with treatment and make it more difficult for individuals to manage their anxiety in a healthy way. 6. Engaging in rituals. Finally, people with anxiety may engage in rituals or repetitive behaviors to cope with their anxiety. They may engage in rituals such as counting, tapping, or repeating certain phrases or words. These rituals can provide a sense of control and calm in the moment, but they can also become compulsive and interfere with daily life. In conclusion, people with anxiety may engage in a variety of behaviors to cope with their anxiety. While these behaviors may provide temporary relief, they can also interfere with daily life and lead to feelings of isolation and frustration. If you or someone you know is struggling with anxiety, it is important to seek professional help and support. With the right treatment and coping strategies, individuals with anxiety can learn to manage their symptoms and lead fulfilling lives. Additionally, it is important for friends and family members to be supportive and understanding of those with anxiety. It can be difficult for individuals with anxiety to open up about their struggles, so offering a listening ear and showing compassion can go a long way in helping them feel supported. Furthermore, it is crucial for individuals with anxiety to practice self-care and engage in healthy coping mechanisms. Some effective strategies for managing anxiety include exercise, mindfulness and relaxation techniques, and seeking support from a therapist or support group. It is also important to address any underlying issues or triggers that may be contributing to the anxiety. This may involve making lifestyle changes, such as reducing stress or improving sleep habits, or seeking treatment for co-occurring mental health conditions. Overall, it is important to recognize that anxiety is a common and treatable condition. By understanding the behaviors and coping mechanisms that individuals with anxiety may engage in, we can work towards creating a more supportive and understanding environment for those with anxiety. With the right treatment and support, individuals with anxiety can learn to manage their symptoms and lead fulfilling lives. It is also important to note that anxiety can manifest differently in different individuals. While the behaviors listed above are common among people with anxiety, not everyone will exhibit these behaviors. Additionally, individuals with anxiety may experience different levels of severity and frequency of symptoms. It is also worth mentioning that anxiety is not a choice or a weakness. It is a medical condition that can have a significant impact on an individual's life. People with anxiety may feel ashamed or embarrassed about their symptoms, which can prevent them from seeking help. It is important to reduce the stigma surrounding mental health conditions and encourage individuals to seek support without fear of judgment. In conclusion, anxiety is a complex and often debilitating condition that affects millions of people around the world. People with anxiety may engage in a variety of behaviors to cope with their symptoms, including overthinking, avoiding social situations, checking and rechecking, seeking reassurance, self-medicating, and engaging in rituals. It is important to seek professional help and support for anxiety and to practice healthy coping strategies. With the right treatment and support, individuals with anxiety can learn to manage their symptoms and lead fulfilling lives. If you suspect that you or someone you know may be experiencing anxiety, it is important to seek help from a qualified healthcare professional. A mental health professional, such as a therapist or psychologist, can provide a diagnosis and develop a personalized treatment plan that may include therapy, medication, or a combination of both. There are also many resources available for individuals with anxiety and their loved ones. Support groups, online forums, and mental health hotlines can offer a safe space to share experiences and find support. Additionally, practicing self-care and healthy coping mechanisms can help individuals manage their anxiety on a day-to-day basis. It is important to remember that recovery from anxiety is possible, but it may take time and effort. It is not uncommon for individuals with anxiety to experience setbacks or relapses, but this does not mean that treatment is not working. It is important to stay committed to the treatment plan and to seek help if symptoms worsen or become unmanageable. In conclusion, anxiety can be a challenging and complex condition, but with the right support and treatment, it is possible to manage and overcome its symptoms. By understanding the behaviors and coping mechanisms that individuals with anxiety may engage in, we can work towards creating a more compassionate and understanding society for those with anxiety. If you or someone you know is struggling with anxiety, do not hesitate to seek help and support.